Hi, everyone. On today's podcast, we're going to talk with Hollis Wakefield, the NICU Doula, about how to help NICU families find empowerment and healing in their experience. Hi, everyone. My name is Rebecca Decker, pronouns she, her, and I will be your host for today's episode. I wanted to let you know up front that in this episode, we will be talking about traumatic birth, hysterectomy, preterm birth, and talking about when babies are admitted to the neonatal intensive care unit. And now I'd like to introduce our honored guest. Hollis Wakefield, pronouns she, her, also known as the NICU Doula, is a former NICU parent turned birth worker, educator, and family advocate. Due to complications from a previous cervical cancer surgery, Hollis's water broke at exactly 24 weeks gestation. Following a 5-day hospitalization, she gave birth to her daughter via emergency cesarean. Unable to breathe on her own, septic, and with nothing but a faint pulse, baby Kepley came into the world at just 1 pound and 10 ounces. Hollis's body had an infection that would not respond to antibiotics, and days later, while still recovering from the original surgery, Holly endured a traumatic but life-saving hysterectomy. After 97 days in the NICU, Hollis and her spouse, Court, finally took their baby home, but the support they'd had in the NICU fell away, and the 4th trimester and beyond was more difficult than they ever could have imagined, especially with a medically complex baby, multiple appointments with specialists each week, and pumping around the clock. Holly's experience inspired her to pursue doula training so she could advocate for NICU families and eventually expand her practice to include teaching other doulas and birth workers about how they can support NICU families. I am so thrilled that Hollis is here to talk with us. Welcome, Hollis, to the Evidence-Based Birth Podcast.
Hi there. Thank you so much for having me today.
Yeah, we are so excited to be talking to you. I know my team and I have been following your work at the NICU Doula on social media for a while, and you've been doing so much to help educate families. And I was wondering if you could start off by talking us about, kind of your journey towards working on this mission to empower NICU families and how you can help whole families get through this process and survive afterwards.
Sure. My experience in the NICU, I knew going through it that we held a lot of privilege in that area. My spouse worked at the hospital, and we had the financial privilege to be able to pay for parking, and I had maternity leave, and so I was able to be there about 14 hours a day every day. But then that mat leave only lasted for 12 weeks. And we were in the NICU for 100 days about. And when that happened, I realized, I'm going to have to quit my job. And we had the ability for me to do that. It was a little bit tight, but it wasn't the plan. But I just knew I had to be there if I could, because I was the one pumping around the clock. I was the one meeting with all the specialists, attending rounds. I was doing everything. And then I think the transition home for us, everyone feels different about their NICU team. We grew very close to ours, and I still text some of our NICU nurses with updates, and we chat to this day. But you get so used to having a whole team behind you if something happens to your baby, and they can jump in and they can reassure you, and then you go home. We went home on oxygen. She had a pulse ox that would go off all the time for no reason. And then navigating all of that she was also getting heparin shots, trying to get to your appointments, like even just trying to get everything out of the car, like the oxygen tank and everything. It was so stressful. And I think I didn't realize how much help we needed until about a year later. Because like all the people that came brought us food, and they were so supportive in the NICU. I think their idea is, you're an expert. You're going home. You've got this. And to me, I always say in the NICU, the beginning of your 4th trimester is when you go home, because you're usually going home if you have a preterm baby. Only about 50% of babies in the NICU are preterm. But if you have a preterm baby, you're often going home around their actual due date. So it really is your 4th trimester starting.
And the babies as well.
Yeah.
Because they completed the 3rd trimester essentially on the outside.
Yeah.
Yeah.
Yeah. And I didn't realize at the time that you can hire independent lactation consultants. I thought I had to use the ones in the hospital, and that was really difficult. I remember they all had different opinions, and I felt like every time someone came in, I was supposed to try something else. No one was on the same page. And that's really tricky with a 24-weeker, especially when they've had an NG tube for a long time. Getting that suck, swallow, breathe thing is usually the last hurdle before leaving the NICU. And I think everyone just kind of wanted to leave us alone. People are doing what they think is best, but I was like, oh no, this is when we needed the most help. But when you're in it, you don't really realize it. It was about a year later. I saw someone that I knew on Instagram who had become a doula, and I thought, I wonder if there's a such thing as a NICU doula. And I Googled it, and I only found like a handful of people who seemed to highlight at least NICU work in their doula work. There weren't very many. And I have a former life in marketing, so this is a very big jump for me. I didn't grow up fantasizing about, I wasn't a birth nerd growing up,
You didn't dream of being a midwife or OB or anything. Yeah.
No. Also, a lot of that was because I thought you needed, that stuff requires serious medical training, and I was always terrible at chemistry. So that was always can't do that. But I told my spouse, and my spouse was like, this is what you have to do. You're already doing this. You're already on the boards, giving people advice. This is what you're already doing. Yes, do it. And I was still it kind of takes me a long time sometimes to come around, and I quietly told a couple other people, and I just had such positive feedback. And Court was like, I'm signing you up for a training, because if I don't, you'll never do it. You'll just worry about all the things. And I was like, okay. So that's kind of how it started. And then the very first day of my postpartum training, I had multiple other students in the group asking me if I was going to teach a workshop on the NICU. And I was like, I'm brand new here. What do you mean? So that should have been my first hint that there was a really big need and hunger really in the doula community to learn about how to support NICU families. Because it definitely wasn't covered in my training. Mm-mm. And at the time I was thinking I was going to mostly be directly helping NICU families. And the longer I've been in this, and the more I even looked back on my own experience, when we were in the NICU, a couple weeks, right around the time we knew we were going to actually be discharged in a couple weeks, a good friend of mine came to visit who had been a doula, and she offered to pay for, as our gift, to pay for some postpartum doula work. And I never took her up on it. And we had a birth doula. I knew about doulas. I wasn't, completely in the dark. And then, I had to start looking back and thinking about even my own experience. And that I think when you're in the thick of it, you don't know what you need. I didn't know what I needed until a year later, in hindsight. And so I think that's how I've kind of come to realize that although I'm always here for NICU families who find me, I think educating other doulas is really where the need is and where the power is, because I can help so many other families if I can help doulas help them. Mm-hmm. So
doulas are the ultimate community workers. They're out there spreading information and
they talk to each other. Yeah. Mm-hmm. Yeah. So I started thinking about putting together a workshop. This is all in my head. And then I got this message on Instagram from someone who I never met before. And they were like, I'd love to talk to you. I was like, okay. So we talked, and their name is Aruna Budram. And they were like, I would love to put together a NICU workshop with you. And so, the universe is like, you need to do this. It just felt sort of undeniable and so strange that it was just coming at me. Mm-hmm. And so we started working on something, and then BADT reached out, and they wanted me to teach a class for their postpartum training. And so Aruna and I put together our first training. And so we're part of that group. And I've done the same training for a few doula collectives. Mm-hmm. And then my plan is also in the next couple weeks to start by the time this is out there, hopefully, to have started a peer-to-peer group.
For doulas who want to support NICU families?
Oh, for NICU families.
For NICU families.
Maybe if that does well, I could do both, like one for doulas and one for just taking one step at a time, trying to.
Yeah. You talked about messaging on social media boards and groups, but I was thinking about the statistics and how, 1 in 10 babies in the United States is born preterm, and due to racism, it's closer to 15% for Black families. And in other countries, rates, may be much lower or much higher, but with the prevalence of preterm birth and the need for NICU care for babies who have other complications, what resources do families have right now in terms of navigating the NICU system and also bringing your baby home? Like, do you feel families, for the most part, get the support they need from what you see and hear? Because you talk with families and doulas all across the United States, or where are the gaps still?
I definitely don't think they get enough support or resources. I think you tend to get more in the NICU than after, which is why I think my focus has been on the transition home. I mean, I give advice on everything, and I can give resources on anything in the NICU too. But I find that in the NICU, people tend to be really overwhelmed with pumping and specialists and decisions and surgeries and work and all of that. And they tend to not have a lot of bandwidth for much more, or maybe not even know what they might need.
So they're kind of like living in the moment, day to day.
You're like minute to minute. Yeah.
Okay, minute to minute.
Yeah. Pretty much everyone calls the NICU a roller coaster, because in the morning you might be like, oh, she's up 20 grams. And then an hour later, there's some other complication. And you just have to kind of be ready for anything. I mean, in my opinion, maternity leave or parental leave there should be something for that gap if you have a preterm baby. I think it shouldn't start the minute you're hospitalized or the minute your
baby's born
at 24 weeks. And then you're supposed to go back to work before your baby's out of the NICU. You haven't had your 4th trimester yet. There should be something to cover that time. And then your regular parental leave could start at discharge. I think that would be a huge help. And even things like parking. I mean, we had to pay, everyone at our hospital had to pay for parking every day. And we know the massive positive impact that comes from parents being bedside with their preemie. Babies go home earlier, they have better outcomes, they have better oxygen rates. I mean, there's just, with kangaroo care, there's so many benefits. Parents are medicine. And the fact that we're charging for parking alone, that alone, what just made me infuriated. And it is actually something that I'm so proud that my spouse got changed at our hospital. So now parking is actually free for everyone. It was one of the things that it was like, if I do anything here, I'm going to change this parking situation. And it should be a no-brainer, and it shouldn't be something you have to fight for or send up the ladder in the corporate world, but it got done. So that feels good to me to know that other NICU parents aren't having to struggle with that. And then, how it is in the hospital, even if you have specific dietary needs. We are vegan, and we had friends bring a little mini fridge when I was hospitalized to the room so that when people brought us food, we would have somewhere to keep it.
Speaking of rooming in, I've read research showing that there are huge health benefits to babies to having the parents be able to stay 24/7 if that's what they choose to do. And unfortunately, most NICUs were built in the model where you have multiple babies in one room and parents can only be there during visiting hours. In talking to families around the country, have you seen more hospitals shift to the private room model where they're remodeling their NICUs so that you can stay with your baby? You don't have to get kicked out at a certain hour of the day.
Yeah, it's happening slowly. And of course, as new hospitals get built, it's happening. I think remodels are always tricky because then where do the displaced people go? What wing do they go to? But it is happening. I would love to see it happening more. I know for a lot of parents, they end up, especially if they're admitted on bed rest, they end up on the same floor as labor and delivery. So and then once you have your baby and your baby's in the NICU, whether it's preterm or not, you can hear all the other people, soothing their babies, and they can hear their babies crying and you're not next to your baby. And it can be extremely traumatic for families. For me, I was septic and in a wheelchair. And even though my baby, like the NICU was on the same floor, you had to go downstairs to the first floor, take another elevator and go upstairs back to the third floor or whatever it was. And so I had to have someone able to push me. I didn't have any autonomy.
Right. You couldn't just walk up and go see your baby.
Right.
You yourself were sick.
Yeah.
Yeah.
But it was nice. And I know a lot of hospitals do this. We had a really big TV screen with, what is it called? NICU cam or NICU something. And I could watch her pretty much 24/7 on that screen. So that was also helpful with pumping. As they say, like, if you can look at your baby, if you can smell your baby. So we had loveys that we would exchange. Some people call them bonding hearts or scent cloths. And my spouse and I also made a website. It's NICUloveys.org, where you can learn how to make a NICU lovey for friends or make them in large numbers for your local hospital. And so you get a pair of them that match, and you put one on your baby and one on, like, inside your bra for 24 hours, and then you swap so they can smell you and you can smell them. And that's especially helpful if you're working on milk production.
Oh, yeah. And I was just going to bring that up because we loved your blog article about gift giving to families who are in the NICU. And we'll link to that in the show notes. But you also talk about a NICU octopus. So could you talk a little bit about that?
I sure can. I could go grab one if you want to, but we have two, and they're little crocheted octopuses. You can get them on Etsy, and there are lots of patterns out there if you know how to crochet. But the cool thing is they're not just a toy, they're actually for developmental and comfort measures. So the little tentacles are curly, and it helps the babies grab onto something that's not their line. And it also can make them remind them of the umbilical cord. And there have been studies that show that they really do help. And then it's just also, I love them also because you can take growth pictures and see, the octopus stays the same. And then you can see how big your baby's gotten. I remember Kepley's head was about the same size as the octopus. It was 20 centimeters. It's about the size of a large clementine. And then as she got bigger, it was like, wow, I can't. You almost have this like memory gap where you can't even wrap your brain around how tiny she was,
I love it. It's like baby's first sensory toy.
Yeah.
To mimic like being inside the womb. And that's, a lot of what kangaroo care is about too, is kind of making them feel safe and that they're still inside of you and mimicking that. Yeah.
And there are I think they need to be cotton. Like you need to look up, usually you wash them in really hot water before you send them out to the local hospitals. If you're making them for a hospital, there are rules for that, like non-scented detergent, stuff like that. But yeah, I'm about to learn. I'm a knitter, so I've never made one, but I'm learning now because I've wanted to make them for so long.
That's so adorable, but so helpful too. So one other question I have for you is that we saw a rise in preterm birth from 2020 to 2021. I was wondering if you could talk to us about what people in the NICU community are saying about the increase in the number of families who are having preterm births?
I think we're really in a crisis right now between the rise in preterm birth. Well, I haven't seen anything that tells us exactly why that's happening. Maybe has been published. We've been pretty busy the last few months. I haven't had as much time to keep up with all the medical studies that come out. But I will also say with the nursing shortage, it's a real problem. I'm seeing parents terrified to go home at night, terrified to go home at all, because instead of having, especially in a level 4, there's usually 2 babies to each nurse. I'm seeing sometimes 4, 5 babies to a nurse, and nurses unable to respond when the monitor's going off and things are not looking good. I even, I posted on my stories the other day, they were talking to a NICU nurse who said they are having 4 babies in their NICU to a nurse. And then if you need to take a break, then you're putting your 4 babies on another nurse. That's 8 babies. It blows my mind. Because even with 2, I remember, so in our room, you have your monitor, and then there's like a little part of the monitor below where you can see the baby in the other room. Like you can't see their face, but you can see their stats. You can see their oxygen and their heart rate. So I could always see, okay, our nurse, our primary is in there. I can see that what's going on. You know what I mean? Like I could tell which baby needed the help more and where the nurse was, and maybe when they'd be back, I could see when things were starting to get better. But with 4, like I don't know. It's so stressful. I can't imagine, honestly.
It's so shocking to me because when I was, in the middle of nursing education and teaching nursing students, there was always a steady stream of students who wanted to become NICU nurses. So I'm really confused as to why there's a shortage in that specialty in particular. Well, is it because they require additional training, after they graduate? So it's not like you can just hire a new grad and throw them into the NICU? Okay.
Right. And it's not every hospital. I'll say our hospital doesn't have a shortage right now in the NICU. So I'm not sure, which hospitals. One of the things I try to tell people or try to really get across is even if you're not high risk, I was very high risk. So we always knew. But a lot of people end up in the NICU who weren't high risk or didn't know they were high risk.
Right.
If you can try to find out before, as early as possible, before you hit viability, find out which levels of NICUs you have near you. So NICUs are level 1 through 4 here. Our birth hospital was a 3, and then we ended up being transferred across the street to Children's, which is a 4. But if you can find out where they are, and then also you want to find out what they consider to be viability at their hospital, because it's changed a lot even in 4 years. So our hospital, when we were going through it, viability was 24 weeks. And if your baby was born before 24 weeks, they most likely were not going to do extensive measures or life-saving measures. There's a really great Instagram account called 22 Matters. There's a big push to change it to 22 weeks. It can be controversial within the medical field, but we're seeing a lot of 22-weekers do really well. A lot more. They still have a much higher mortality rate than even 24 weeks. But, parents, I think it should be their decision if they have a 22-weeker and they want life-saving measures. I personally think they should be given that. And a lot of hospitals are bumping it down to 22 weeks, which is really awesome. Mine has. I know some of the others in the area have. And there are resources on my resource page. I know we have one up for Texas that lists all of the levels of the hospitals, of the NICUs. But yeah, if you can find out which hospital has a viability that resonates with you and what levels they are, and you go into extreme preterm labor, then it's a lot harder to get transferred than it is to just go to the hospital right away.
Okay.
Getting transferred is a lot is a lot harder. And usually they have to wait till your baby's more stable to transfer them.
So that's really important info for parents to know. And I don't think most parents think about the level of NICU that their hospital has. And I think it's one of those things where, we talk about the research on home birth, for example. No, there's not a NICU at home, but some hospitals don't have much of a NICU either. Yeah. So it's important to know what your options are if you go into labor early or you seem to be having complications.
And if you're traveling, also, I've had 2 different friends who were traveling far from home who ended up with micropreemies in cities they didn't live in. So, I mean, I'm definitely an over-researcher, but knowing what I know now, if I were to be pregnant and to be traveling, I would definitely want to know what's nearby as far as hospitals also, even if I'm, at 20 weeks. Because if you end up on bed rest, you're going to be stuck at that hospital.
Right.
And
I think, you're mentioning, they're able to save babies earlier in earlier gestations, but that means the babies in the NICU are sicker and in need of more care. And there's more people having preterm births. And then we have a staffing shortage on top of it.
Yeah.
So knowing how is staffing at your local hospitals, like asking around and finding out, are there issues or not? Because some hospitals probably don't have problems and others are chronically short-staffed. So that would be important for parents to be aware of as well.
I will say another reason that NICUs are more crowded, and it was one of the first things that occurred to me, is when the Dobbs decision came down. That's going to lead to more babies in the NICU. Because it's more babies in general. And then if you are being forced to go forward with a pregnancy that's high risk, or that you may know the baby's not going to last long after delivery, that's more babies in the NICU. Also,
and those are more stressful pregnancies, and we know
more stressful, more high risk,
contribute to it. Yeah.
And I think that is one conversation that's really been left out of that whole situation.
Right. And I think also climate change and reproductive justice involves climate justice as well. And in our recent article on premature rupture of membranes, or when your water breaks before the start of labor, we have a whole section in there about heat waves and extreme cold, extreme weather events can contribute to preterm birth as well. So can pollution. So there's a lot of factors we don't really fully understand yet. But I think it's important for families to also know about ways they can bond with their baby and, take care of their mental health. So could you talk a little bit about, the impact of a NICU stay, but also what are some solutions, what are some things families can do when they find themselves in this situation, or if they find themselves in this situation?
Sure. I would say, first of all, it's really, really normal to have difficulty bonding in the NICU. I've seen so many parents feel guilty about that. But if you can't be with your baby as often as you want to, you didn't even get that 3rd trimester, that's also another level of bonding. You really do bond during that trimester. But when you're in the hospital, you might have your own previous or current medical trauma, right? The smells, the sounds, the lights. We all know that none of that is
needles.
Conducive.
Yeah.
Needles, IVs, the crappy food, we all know that that's not conducive to bonding. If you're in the NICU, we got the bonding hearts. I would say do as much kangaroo care as you possibly can, which I know can be tricky. I remember being very frustrated by the rules of the NICU, but then also how much they wanted me to do kangaroo care. So no eating in the NICU. Keep your milk supply up. And they're the first hospital we were at. If they got us into kangaroo care, because it can often take, at least one nurse and one respiratory therapist to even get the baby into position. So it's a thing. It's a little bit of an ordeal. It can be stressful to see a teeny tiny baby with the CPAP and all the leads and everything. That alone can raise your cortisol, right? But in that hospital, once they got you into kangaroo care, you had to stay there for at least 3 hours. But drink plenty of water, but you can't go to the bathroom. I just remember being so frustrated with the rules and how they counteracted the other rules or the things they wanted me to do as a parent. That was really frustrating. You can sing to your baby. You can read to your baby. If you have I always call it child development. I think it's called something else. The team that works on how the babies are developing. I know our team gave me a sheet for it's like 22 to 24 weeks. I got a piece of paper that said, this is how your baby's developing now. This is what they like. This is what they don't like. This is what stresses them out. And that changes every week to 2 weeks. So in the beginning, the whole room had to be dark 24/7. And then at a certain point, you were able to take the blanket off the isolette and let a little more light in during the day. So that was really cool for me to know, just even developmentally, what she was going through, what kind of touch she liked. So early on, it's firm pressure, nothing light, nothing strokey, because their skin is so thin and it's not comfortable for them. Or when they're going through your daily cares. So every usually 3 to 4 hours, the nurses come in and they do temperature, they do any heel sticks they need to do, change a diaper, just your regular cares. If you are able to, you can do what's called a hand hug. So you can kind of put your hands on each end of the baby, keep their arms here and their legs up to comfort them. And I remember asking the child life team, I said, I'm stressed out because I feel like if she smells me during the stressful time, she's going to associate the stress with me. And they were really good about reassuring me, telling me that's not what the evidence shows. And so I would jump in when it was cares time, and I would change her diaper, and I would do the hand hug. And there's usually something about the cares that the babies don't like. Each baby's different. My baby hated having her temperature taken. That cold thing right under her arm, she would scream, and then the rest of cares was terrible. If you can save the thing they don't like for the end, then you can keep their cortisol down a little bit longer, so it's not quite as stressful for them. So you can do all those things in the NICU, but then when you go home, if you're feeling like, oh, I haven't bonded with my baby, it's an excellent time to do baby wearing as much as you can. That's what we did, and I really felt like it helped us bond. I will also say, this is slightly unrelated, but I want to get it in. Some hospitals have libraries, and they can be incredible resources. So if you get a diagnosis and you don't understand what it's about, or they're asking you to make a really big decision between 2 treatments, if you have a library, you have medical librarians, and those medical librarians will pull studies for you.
It's like your personal EBB for the hospital.
Yes, yeah, kind of. And that way you're not on Google trying to search through studies and what's newest and which study was actually more done the best, all those things. They'll pull books for you. And I didn't actually know that till we had gone home, and we were facing some other diagnoses once we got home. And Court was like, let me reach out to the librarians. And they, even though we were discharged, they were so kind, and I just would get email after email, like, here's some more studies. It was really cool. And I really, I felt supported by them, and librarians are just awesome. So,
and speaking of research and NICU research, I know on your website, NICUDoula.com, there is a page with links to different research studies and places to get education. So I want to make sure we mention that, so you can go find that in the show notes, because there's so many topics we could cover today. We didn't even talk about feeding and pain management and other things, but I wanted to let people. That's another
thing you can do during cares.
Yeah.
You can get a little syringe and do a little bit of breast milk if you are lactating, or you can do a little sugar water, and that actually helps with pain instead of having to do pain meds.
Yeah, so that's why they recommend, if your baby's getting shots, even at full term, or, you can nurse your baby while they're getting their shots, because it relieves pain. Yeah. So, but that's a whole big rabbit hole. Yeah. We could go down. One last thing I was wondering if you could talk about before we go is, talk about perinatal mental health. So what tips do you have for parents who are coping with both a NICU admission and then kind of the going home and the afterwards that you talked about earlier. Like, what are some tips you have for getting support or for protecting your mental health?
If you're able to have a doula, I think a doula is always a great way for an impartial person to interact with you and be able to talk to you about mental health if they notice anything. Definitely, you guys have some great resources on mental health. You can get their checklists online and you can keep them around. And because I know actually this last year, I started perimenopause unknowingly. And I had insomnia for a year. I couldn't sleep. I had anxiety and depression. And even though I know all the symptoms of depression, I had no idea I was depressed. I thought I was just tired until my doc got me on the right meds. And then all of a sudden I was taking my child to the library every day and doing laundry and able to get off the couch. And I had sort of almost misdiagnosed myself with just insomnia. And I didn't even realize what I was going through. So I think the more people in your orbit that know the signs that can maybe, help you see them yourself. I've known other therapists who didn't realize when they were themselves going through some mental health struggles. So if you can have people around, if you already have a predisposition to those things, obviously talk about that with your OB ahead of time.
Is it possible because my understanding, not having lived through this myself, is that having a preterm birth and a NICU admission can be traumatic. Yeah. So would it make sense while your baby's in the NICU, before you get close to going home to ask the hospital for to talk with the social worker just to get you set up to have someone to help you process what happened to you? Is that something that the hospitals are willing to help you with? Because I know a lot of families, they get home and they want to find a perinatal mental health specialist and they can't find one that takes Medicaid, or they can't find one who has an opening. So do hospitals ever help people connect with therapists before they go home?
Yeah. Well, each hospital is different. Our social worker was really great with connecting us with different resources like that. I would definitely say reaching out to your local doulas. They will know more about who in your area, even if it's lactation, they trust. Because I know when I left the hospital, the lactation team there was like, oh, there's this clinic near you, because we were having trouble with latching. You can go see them. Well, then I called them and they said, sure, bring her in a little bit hungry, but not too hungry. I mean, I immediately was like, bye. That's not going to happen. I'm pumping every 2 hours. Like, she's on meds. We've got appointments. Like, it literally seemed impossible to me. It felt impossible. So if I'd known that the doulas in my area would know who could come to my house, that would have made such a difference.
Right.
Just for us. And it's the same for mental health, I think. It is really hard to find mental health professionals who specialize in birth trauma or birth or things like that, because people in the NICU have a much higher rate of birth trauma and PTSD, as well as NICU partners. I think it's definitely something that's not talked about a whole lot outside of NICU circles. And it's also common for you not to start processing things for a year or two later. I think that catches people off guard too.
It's like often the baby's first birthday might be when the trauma you start to process it, what happened to you.
Absolutely.
Yeah. So Hollis, thank you so much for talking with our listeners about how families can find healing in their NICU experience. Can you tell our listeners how they can follow and support your work if you have any other resources you want to give a mention to?
Sure. I'm on Instagram as the NICU Doula. My website's NICUDoula.com. And there's also a contact form on the very bottom of the homepage. So if you want to find out about the peer-to-peer groups or anything else that might be coming out, feel free to sign up. I haven't sent an email yet, so you're not going to get a bunch of spam. And what else? I think, the NICULovies.org that's where you can go if you want to find out more about NICU levies. So
that's awesome.
And you can always message me on Instagram too.
Mm-hmm. Thank you, Hollis, for all the work you do to educate families. And I feel like I learned a lot today listening from you, things I didn't know about the NICU. And I appreciate you helping spread the word.
You're welcome. Thank you for having me.
Thanks, everyone. And we'll see you next week. Bye.
Bye.